This is another in a series of descriptions of applications where prolotherapy or regenerative joint approaches might be an option for patients looking to address what is dubbed either hypermobility or loose jointedness. Might be somebody described as having double joints. Ehlers-Danlos is one of the types of hypermobile conditions, genetically related, that patients are becoming more and more aware of and often more likely to be diagnosed with or suspected to have when they present with either loose joint conditions, joint pain. And typical examples might be athletes or folks who in their early days, it might have been a really good advantage to them to be loose jointed or hypermobile. And I'm just thinking of some sports and activities off the top of my head, like ballet, other forms of dance, certain sports where hypermobility actually may be an advantage. There are many athletes who may, during their careers, benefit from being a little looser jointed, and I'm thinking of gymnastics. One example, well-known swimmer, Michael Phelps. If you ever watch him in the pool with slow motion, his elbow actually hyperextends, which gives him more force through the water. So again, in some situations, being hypermobile could be a benefit. Now, what I often see and a lot of my colleagues see is years down the line where that hypermobility has contributed to an instability problem of the surrounding joint, where that hypermobility is affecting the joint. And how does it occur? It's either because of trauma, or it could be genetics, Ehlers-Danlos being one form of hypermobility, where the ligament or ligament facade or complex of ligaments, that surround a joint become overstretched. It might have been related to a tear, a micro tear, an overuse injury, where those same structures become more lengthened than they're supposed to be. And what that can create rotational torque. It can create instability where now the joint itself is starting to be under the gun. So examples I'll show in a minute show where certain structures that we call ligaments, if they are damaged or hypermobile or loose, it will later on create a symptomatic joint, and often arthritic joint. So in prolotherapy, we often think of arthrosis or arthritis conditions affecting a joint might indeed be related to genetics, of course, but also may be contributed to by hypermobility in some cases, where that laxity is not allowing the joint to be properly stabilized. Here we have bones that would be this would be the femur. We have the tibia, and the joint space right in between. Here's the patella. The idea here is that this joint is supported in part by a fairly complex cluster of ligaments that I've just now added with this program, showing the many different layers of ligaments, where you could imagine if any of these are torn or damaged. Examples might be running injuries or soccer injuries. These could be ligaments not only outside the joint, which is demonstrated here, but maybe inside the joint capsule, examples being the ACL, the anterior cruciate ligament. But for sake of just looking at the outside of the joint capsule, a common injury that may occur may affect the medial collateral ligament, which is on this surface of the inside of the joint space or the joint line. And if torn, that may lead to a inability for that knee to remain in a stable position with running, walking, hiking, going up hills, and it may create a torsion effect on the bones to create a rubbing effect, and therefore the pressure, if the ligaments are not in a biomechanically stable status, you may end up contributing forces to the joint itself and thereby compressing internal structures such as the meniscus within the knee, as an example. So many have argued that if stabilization, a comprehensive stabilization approach with prolotherapy to the knee joint is one example to address hypermobility, you may therefore arrest or delay or prevent further damage or deterioration to the knee joint, and thereby minimize chances of arthritis setting up shop down the line. And certainly this would help be an approach that we often, almost always use when we're dealing with meniscus injuries, not only by treating the joint itself, but also doing a comprehensive treatment around the joint. And here we're looking at the medial or inner surface of the knee joint. So how and what would we offer? These would be solutions we've talked about in previous videos that may include hypertonic dextrose solutions, might include plasma, including platelets or PRP, and other injectant solutions that provide a scaffolding effect to create a repair effect to those ligaments and basically replace what is a biomechanically loose structure in something that replaces the existing tissue and creating more of a biomechanically more like the old tissue used to be. And we've talked about this with the difference between native tissue and scar tissue in another video that I've put on my website. So here again is another example where hypermobility, creating joint pain, might be an indication for consideration of prolotherapy, where we can actually address the stabilizing effect of those ligaments. Here again is an example where cortisone or corticosteroid injections just won't help this problem, because steroids don't produce a regenerative effect. They may reduce pain, but only short term, and we need something that's going to do a much better job of creating a long-term solution to the problem, essentially a restructuring. And here again, the benefits about Prolo is, including dextrose, including PRP, it's non-operative, doesn't require any off time for the athlete. They don't have to take away from training or from their usual routines, and that would be a distinct advantage for many looking at non-operative solutions, especially if it doesn't necessarily need surgery. And if surgery is opted for, we may be looking at weeks of being off for recovery. So here again, Prolo offering an advantage over some who are looking at non-operative procedures, a definite answer to helping joints become more stabilized. And then that allows a platform where further physical therapy can contribute to better strengthening. And multiple examples of this that I've seen in my office and treated with prolotherapy, where physical therapists will report back that they're able to do more advanced physical therapy. They're able to do more strengthening as things start to hold and not keep slipping around, and finding that the joints are now much more stable. So that allows for decreased pain, allows for increased functioning, and as I've always said, we would offer these as ways of getting people back to the sport of their choice, the things that they love to do, and get them back out there and doing all the things that they enjoy doing. So with that, I offer any additional questions. Feel free to contact me at my office, and additional information we can certainly provide you. So again, thank you for your attention. I will be putting in some additional links where this subject is discussed. If you're interested, please click on the links that'll be below, and appreciate it. All righty, you take care. Bye.